Hi, I'm Paul Friedman. I'm a cardiologist at Mayo Clinic and chair of the Department of Cardiovascular Medicine. And today I have the great pleasure of being joined by my colleague Rita Khan, who's Mayo Clinic's Chief Digital Officer, and by Dr. Sumbul Desai, who's the Vice President of Health at Apple. Rita and Sumbul, thank you so much for joining me today.
Thank you. By the way, Dr. Friedman, I just want to say it's been really inspiring to see the work that you have put out, and the research that you have done is really, really inspiring, and such great work that's laying the ground for such important transformation of care.
Well, thank you. And we're fortunate to have many partners to work with and look forward exploring that in this conversation. And I'm excited to have a conversation about digital health. So why don't we go ahead and dive in? So, Dr. Desai, I'd like to start by asking you some questions because you have the unique perspective of working at the intersection of technology and of healthcare. And as physicians, we see the rise in patients coming into their appointments, showing us their health data on their iPhones. But Apple's a consumer technology company. So tell me a little bit about how that shift happens and how you see that playing out in the future.
I mean, it's a great question. And our approach in healthcare and just to health in general at Apple has really been very organic. We launched Apple Watch in 2015, and we had included a heart rate sensor. And we really actually mostly thought about it as a fitness feature because we wanted to track your heart rate during workout and just make sure that our calculation of calorie measurement was accurate. And just by the virtue of including a heart rate monitor in a device that you wore as frequently as you wear the watch, which is, you're wearing it all the time, we started to get notes from people who noticed something strange about their heart rate and then decided to see a doctor. And I think that's really where we started to pull on that thread and think about, what does that mean? And so for some, when we got those initial letters, it was a heart condition. We've even had, individuals have severe infections, life-threatening allergic reactions. It's a really early span of things. And so that work really accelerated our approach in this space. So we then thought, okay, well, since we have the heart rate monitor on, let's introduce something called high heart rate notification and low heart rate notification, which basically, if your heart rate's above a certain threshold of 120, and you can actually select that threshold. We give you what's considered high heart rate. We give you a choice of thresholds. You can actually select which threshold you're at and get notified. And that even led to more letters. And so we were like, okay, well, we've got heart rate down. Like, what else can we do with heart rhythm? And that drove us to explore even further. And that's what led us to our work in atrial fibrillation with the ECG and irregular heart rhythm notifications. And really the goal was, how do we help people sooner? How do we enable people to be proactive around their health? We've now expanded our work to 17 areas of health. So that includes sleep, menstrual health, hearing, medications, mobility, fitness, and more. And so what my point of telling you all of this is that it's really just been a very organic journey. We've been very much on where are we hearing from customers? Where can we pull the thread? How do we do something that's science-based, actionable, and making sure that we keep privacy at the core of everything we do? Because when we think about privacy and technology, we think that you should have the same confidentiality from your technology as you do from your doctor. And that's a really core principle for us, as is being scientifically based. And so in a nutshell, we view ourselves as very early in the stage of healthcare and our journey. We think there's a lot more to be done. But these stories really inspire us. Hearing from our customers and our users really inspire us to build more work that we can enable people to be more empowered and proactive around their health.
I've certainly seen it in my own practice where people are able to record important findings, share them with me, and it's useful information for adjusting medications or taking other actions based on those recordings. You touched on privacy, and that leads me to two additional questions. The first one is, tell me about scientific validation, because the Apple Watch was historically a consumer device. So what steps do you take towards scientific validation? And then my follow-up question will be, tell me a little bit also about FDA regulation, because I know components of it are FDA regulated, but kind of tease that apart for us. What is, what isn't, and what does that mean?
Yeah, it's a great question. So first, to start with one basic principle in terms of how we think about it. Because it's a consumer device and it's in everyone's hands, we actually believe very strongly that we need to hold ourselves to a higher level of scientific validation. Because you don't often have a physician to translate all of this information. We're often communicating directly with you. And so because of that, the science that basically supports the work we do, in our opinion, has to be even stronger and clearer. And a lot of times we will not do certain things if we do not feel that A, we can explain it, B, it's actionable, and C, if we don't feel like the science is strong enough. And so, the way we approach this is we have clinicians involved in the development of our health features. So including myself, we have a team. We know how important it is to have trust in the data that users receive. And we want to make sure we're comparing our data and our results to the gold standard. So we look at mountains of data, we look at peer-reviewed publications, we spend months and years deciding if we're going to do a feature with feasibility, and then we do trials and studies. So for example, with the ECG app, we had validated against the clinical gold standard of a 12-lead ECG, and we found our algorithm achieved about 98.5% sensitivity and 99.3% specificity. And that was really important to us because we wanted to make sure, especially, and I'll touch on this in a minute to your question, because it was a software as medical device feature that was regulated, we wanted to make sure we had the data that supported it. As you know, our regular heart rhythm notification was released after we completed the Apple Heart Study. We actually potentially could have been ready to release that a year earlier, but we strongly believed that we wanted to understand what that would do out there in the real world. And we wanted to work with the scientific and medical community to do that and understand what this technology could mean. So that's what drove our desire to approach that study, which ended up being one of the largest digital cardiac studies of its time with over 400 per thousand participants. The irregular heart rhythm notification feature has a sensitivity of 88.6, an AFib detection, and a specificity of 99.3. Again, just giving you a sense of we do pay attention to what our metrics are. If we don't feel like it meets a bar, especially particularly, we're really thoughtful about false positives because we don't want to impact the health system negatively. It's something we spend a lot of time thinking about and talking about. So we really will think about how do we make sure that the sensitivity and specificity leads us, as well as looking at our false positive rates, positive predictive values, all the things that we should be looking at to make sure that our data, we can stand behind our data and feel like we are putting something out there that is helpful. And then the last thing I'll say is we actually apply that rigorous testing to all of our health and wellness features. So for example, if you're using the swim feature on Apple Watch, we've actually validated it against people doing the actual stroke in a pool. So we've spent a ton of time, whether it's a health and wellness feature or if it's, one of our more software as medical device features, which is regulated, we spend a lot of time validating it. Just to give you an example with sleep, the machine learning model for our sleep stages insights was actually done, basically we wanted to look at how much time people are spending in REM, core, and deep sleep. And those were trained against a clinical gold standard of polysomnography with one of the largest and most diverse populations ever studied for a wearable. So that is what I want you to take away is once we believe in the rigorous testing of our work and our features that we put out there. And we want to make sure that not only will our customers and users understand what the results are, but we want to have the trust of the medical community. We think that's really important, which is why we also regularly share white papers on the development and validation of our features with the clinical community so they understand our approach.
Makes good sense. I just have one more follow-up question. That is, are most of these features nominally on, or does the user need to turn them on? And I'm asking that in part because obviously AFib detection is one example. Is going to be very different between an 18-year-old and a 66-year-old.
Yeah, so with the AFib feature, you actually have to turn it on because one of the things we do is we want to onboard you, and we do ask you the age of what you are. So for a number of our features, we actually have something called safety checklist. So you'll be able to go in and health checklist, and you'll be able to go in and turn on these features. So a lot of our passive detection features, you have the ability to turn on and turn off. We want to make sure the user's in control and they understand what's involved and what they're going to receive and what these features will tell them and what it will not tell them. So we do make sure that you can actually turn on and turn off these features.
We're surrounded by so many digital tools these days. I want to ask a few questions to you, Rita. Which digital devices, tools, and services do you consider mainstream in the healthcare industry now? And which ones are so mainstream that maybe patients don't even realize that they're part of the digital health ecosystem?
Thank you so much, Dr. Friedman, for this question. There are so many digital devices, tools, and applications that have become mainstream. For example, I think we all take for granted the variety of ways we make an appointment with your doctor. You can call for an appointment or have a virtual visit with your smartphone. You use your laptop, a tablet, or again, your smartphone to do self-service online to access your information, such as interactive care plans, access your patient portals that are tied to your medical records. And of course, there's predictive analytics and machine learning that's already present in our daily lives, such as getting a reminder, getting a recommendation, sensors, tracking your sleep, or seeing autocomplete when you just search for something online. You're engaging with digital tools to make life easier all the time. There's so many benefits from having devices like the smartphone or a watch, such as the Apple Watch, that put digital solutions in our hands, and in this case, on our wrists, which is part of our everyday life. We don't even think about the many ways these devices and digital tools can make our lives better and make our health easier to manage.
Well, Rita, thank you. It's just fascinating, really, how digital tools are becoming integrated and part of our lives. Dr. Desai, what are your comments or thoughts on the same topic?
Well, I couldn't agree more with Rita. I think at the end of the day, one of the things that we think about is it's really truly an honor that our iPhone and watches are often with our users all the time. And as people increasingly use them for things like payments, tracking how much the steps they take, navigation. I know I had to use maps getting here. It actually ends up being this indispensable tool. And we kind of view that as an opportunity and almost a responsibility to be able to help an individual really think about their health more proactively and manage their own health and actually help be that kind of that partner to you in your health journey. And so we think about all of our features that way. And you see that taking shape in a number of our features. For example, the cardiorespiratory fitness, how it changes over time. It allows you to look at how things may be changing over time. I know when I had a knee injury, I noticed a big change in my cardio fitness, gave myself a goal to kind of get it back improved over as I continued to recover from my injury. And so those are those things where we want this information to be with you every day. We proactively and passively collect that information so that with the user's understanding and obviously with a very private approach, so that the user can learn from that information. And the way I think about it, you'll both understand this being in the healthcare system, when we go see patients in a clinic, we just see that snapshot in front of them. The fact that we are with you all the time allows us to kind of fill in those blanks in between visits. So almost think of this as like another type of camera. And that kind of information is really valuable and hopefully enables us as providers to have more enriched conversations, pick up things that maybe we would not have picked up when they're at home. And we really view it as an opportunity both for the user and the physician to engage in a way that they haven't, to be able to be motivated to make healthier choices for themselves.
Rita, I wanted to ask you about your work in Mayo Clinic Center for Digital Health, or CDH. What are some of the exciting developments happening within CDH right now?
Well, the industry is changing. Our patient needs are changing. Patients want quick, easy access to their medical records. They want to see doctors like you. And of course, they want accurate diagnosis, treatments, all wrapped up in a simple and seamless experience. Health technology using machine learning is a key component to Mayo Clinic's bold forward strategic initiative to improve healthcare through insights derived from data. Machine learning and other AI tools can help cure more patients, connect people to data, create new scalable knowledge, and transform healthcare. But the use of AI can address health equity and healthcare in very promising ways, but it's not perfect and it requires our intention. We always want to make sure that we have controls in place to protect quality and outcomes for our patients. However, this should not prevent us from learning and leveraging technology more responsibly. I'd love to ask you both about a new short film that was recently distributed by British Broadcasting Corporation. The BBC debuted a series of short films under the title Technology's Golden Age. And as part of that series, it featured Mayo Clinic's study that used the Apple Watch. So Dr. Friedman, I know you appear in the film. Can you share a little bit more about that?
Sure. Apple made the raw data from the ECG available to scientists in HealthKit a year and a half or two ago, which really opened it up. And so what we did, partnering with the Center for Digital Health, was we created an app. And the concept was to sort of extend what we've been discussing can we use information from people's day-to-day lives to see how they're doing and apply it in a medical environment? There are really two separate components. One was the data that comes in from the Apple Watch is very rich, but it goes into an email or something. We wanted it in our electronic medical record so that everyone could see it. So we created a dashboard that anytime a clinician logged into our electronic medical record, they could see all the transmissions in one place, sorted by date, along with the actual strips and tracings. Then with the app that the Center for Digital Health developed, we invited people who had been seen at Mayo Clinic at some point in their lives to participate in the study. Now, because it was digital and remote, at this point in time, they could be anywhere on the planet. And so if you think about it, this fundamentally shifted a clinical trial where normally we have to wait for people to come in. We ask them if they want to be in a study. In this case, they get an email note. Would you like to be in a study? If they say yes, they do an electronic consent form. Then they get a link to download the Center for Digital Health app. And that app allows them to send all of the tracings they've recorded on their own iPhone to us in a HIPAA compliant, secure manner to maintain that privacy requirement, and then put it on the dashboard so any clinician can see it. So by that means, we, in 5 months, with one part-time study coordinator, enrolled roughly 2,500 people from 46 states and 11 countries and received over 125,000 ECGs. People ranged in age from 18 to 94. The older people were actually as engaged. I was, thinking, gee, would my grandparents been able to, they can, they do, they were engaged. I think in part because they know that the information will be available to their healthcare team. People stayed active throughout the entire time of the study, and we did collect a lot of these. And then what we did was, since we had so many of these samples, we thought, can we use these to identify a weak heart pump? So by way of background, we had previously done work showing that with a 12-lead ECG, which is where someone lies flat, you get the stickers put on your chest, on your legs and arms, and a 10-second electrical recording of the heart is made. Using artificial intelligence, a kind of advanced processing, we trained a network using Mayo Clinic stored data to identify a weak heart pump. A weak heart pump is something that usually you would need an ultrasound of the heart or a CT scan or an MRI scan to identify. But we found that with artificial intelligence, a standard 12-lead ECG, a non-invasive 10-second, widely available test could do it. But we wanted to know, could we use the ECG from an Apple Watch, which is one lead instead of 12, to do the same? And if you think about it, a 12-lead ECG is done in a medical environment. A technician prepares your skin, tells you to lie still, acquires it. An Apple Watch can be done anywhere. I may be laying on my sofa after dinner and go, oh, I wonder what my heartbeat's doing, and just make a recording, right? And to my frank delight and surprise, the network, we had to modify the algorithm because the watch ECG is filtered just a little differently than 12 lead. So we had to retrain it, so to speak. It's as if you know how to read English, but you've only been taught block letters, and then someone hands you something in cursive. You'd pick it up quickly, but you just need to do that translation piece. So we did that, and we found that, in fact, it was a very powerful tool for identifying a weak heart pump. We measure the strength of a test with what we call the area under the curve. A 1 is a perfect test. An exercise treadmill test, widely used by cardiologists, is a 0.85. This test, the ability of a watch tracing with the addition of artificial intelligence to identify a weak heart pump, was a 0.89, so a powerful test. And in the video then, it explores the life of one of my patients, very graciously told her own story. And it also explores the input from Dr. Zaki Attia, who's co-director for artificial intelligence and really developed the artificial intelligence network that was used for the weak heart pump screening. And she tells how she was having episodic irregular heartbeats, wasn't sure. And by using the watch, when she had symptoms, she could transmit it. I opened it up on our dashboard. I could immediately see all the tracings and say, oh yes, at this time of day, on this date, I see there was a change. It correlated with symptoms, and we could arrange for treatment.
That's amazing.
I think it really highlights the topics we were discussing. That is the very real ability for tools today to, when properly used in a medical environment, help guide treatment decisions.
I think that's exactly right. And I was so excited to hear about this study when it launched, Dr. Friedman. And, both you yourself and Dr. Attia, and the whole team at Mayo are just doing really amazing work to transform care. And in the film, you mentioned that 12.1 million people are estimated to have AFib by 2030. And, if you think about it, the reason we care about AFib and the reason that was one of the conditions that really stuck out to us is that the risks can be so high that many people don't feel symptoms. And so they often can't advocate for their care in time. And so the fact that we can potentially proactively pick something up, hopefully will lead to one, just a better outcome for your patient, but obviously saving the patient's time and hopefully any serious issues. And we think that these, potentially timely insights can really impact their lives in a very, very positive way. So we were really thrilled to see the work that you've done. And I think it's remarkable, the learning models that you all developed to be able to detect some of these things more broadly with regarding the weak heart pump. So congratulations.
Well, thank you.
Amazing work.
Well, thank you. And maybe for non-medical listeners, I should state that atrial fibrillation is an irregular heartbeat. And in some people, not all, but in some people with concomitant risk factors, there's a risk of stroke. And that's why we really care about finding this heart rhythm that people may not find, mostly in people over the age of 65 who often have other conditions like high blood pressure, diabetes, previous stroke, narrowings of arteries. But in that context, there are treatments that can lower the risk of stroke substantially. And that may be medication, it may be a procedure, maybe other things. And that's why identifying atrial fibrillation in the right people with the right characteristics is important. So for some people, Absolutely. It may not be as critical, but for others, it's terribly important. And our goal is to help identify that cohort. Rita, tell us a little bit more about the role of the Center for Digital Health, because it was central to this study. So maybe fill us in about how CDH did what it did and more about what it does.
Yeah, absolutely. But first I'll say these are the types of things that the Center for Digital Health like to do. We get really excited about working with our care teams to solve real problems, and we love the challenge. So when Dr. Friedman when you and your team came to us, we wanted to solve this problem. In fact, from idea to deployment, it was about 90 days. That's how quickly we could move to support this. So what did CDH do? Well, we worked with the team to develop a mobile app in partnership with the Cardiovascular Disease Division and other colleagues across the organization. The app allowed us to work with patients from around the world by essentially moving their smartwatch ECG data on a regular basis to a secure research server within the cardiology department at Mayo Clinic. Our ultimate goal with digital tools like AI and this innovative study that involved Mayo Clinic's researchers and the use of the Apple Watch is really to detect diseases earlier in patients so that we can bring treatments to them sooner. And so we are getting more effective and more efficient by putting out these tests and building out solutions faster so that we can scale and we can better accommodate care, research, and education for Mayo Clinic.
I would just add that not only is this supporting research, but it is so clinically useful in so many patients who we see today, because the ability of a device they already own, they're already wearing all the time to help monitor their heart rhythm and have that information made available in a medical environment through the CDH app and then onto the dashboard is huge. I mean, we enroll patients in it all the time as a clinical tool and anticipate a future where it becomes part of our infrastructure at Mayo Clinic because it's so very helpful. There's nothing you need to put on your chest, no additional test to order, no additional preparation. Put on your watch, do your usual thing, and we have medical information. So it really has been very, very helpful in that sense.
And tools like this really increase accessibility to participation. And so the more ways we can leverage tools that are already in the hands of our patients just help accelerate the work that we need to do.
Well, Rita Khan, Dr. Sumbul Desai, such a pleasure to talk to you both. And I think our conversation underscores how with a firm scientific foundation, partnerships between those in the technology space, physicians, academic communities, investigators, we can work together to try to improve human health. And I appreciate the conversation. It's been fascinating.